Thank you everyone for joining us. Today is our last session in our Health Equity for Transition Age Youth series, and we're very excited for you all to be here. So the purpose of this project has been to equip pediatric and adult healthcare professionals with strategies to ensure successful healthcare transition for children with special healthcare needs and youth with disabilities. Participants are going to gain an experience or expertise in providing care for patients with disabilities and special healthcare needs, learn how the social model of disability can aid in identifying and addressing ableism within healthcare settings. And today's session is going to be focused on strategies to support a successful transition from pediatric to adult healthcare. Your participation is key to the success of our ECHO sessions. We really want to create an interactive community where our presenters, stakeholders, and community members converse and support each other during a session. So we encourage you to turn on your camera as long as you're comfortable doing so. And we also appreciate when you are engaged in asking questions after the didactic and provide feedback for the case. These case narratives are the best way to solidify skills learned in the didactics and receive direct advice. So feel free to upload your questions into the Zoom chat and we'll address them at the end of the presentation. You can earn CMEs and social work or nursing contact hours for your participation in the series. To receive credit, please fill out the pre and post tests that have been sent to your email, and they'll also be included in the Zoom chat. Please note that you need to be registered in IECHO. Oh, I'm sorry, that's an old note. So you can find the links to the pre and post test in the chat. So we'll go ahead and get started with some introductions. I'm Krista Opstedal. I'm the project director, or Project ECHO director here at the North Dakota Center for Persons with Disabilities. And today we have Jody Patchen on the call with me.
Hey everybody, I'm Jody Patchen. I am the project support. And I just put the pre-test in the chat. So if anybody hasn't taken it yet, it is available for everyone.
Thank you. Jody's helping out with the evaluator role today. We have Kyle Erickson on our team as well, but he's attending a conference. So Jody's wearing multiple hats today. So thank you, Jody. We also want to give a shout out to our hub team that helped us develop this series. This includes North Dakota Family Voices, WIND at the University of Wyoming, and the North Dakota Special Health Services for not only their knowledge, but funding for this series. And also want to thank UND for providing the CMEs for these sessions. So we'll go ahead and get started introducing our presenter, Miss Heather Capella. Heather attended Presentation College where she graduated with a Bachelor of Science in Nursing. She has experience working as a nurse in a variety of settings, including labor and delivery, pediatrics, family medicine, and public health. Heather currently resides in Mandan, North Dakota, and serves as a Special Health Services Program Administrator and the State School Nurse Consultant at the North Dakota Department of Health and Human Services. Within this role, Heather strives to improve and enhance the lives of children with special healthcare needs and their families, and improve the maternal and child health systems of care in North Dakota. In her free time, she enjoys watching her 3 children participate in various sports and activities and volunteers as a foster parent for local animal rescues. So please help me welcome Heather. Go ahead and stop sharing so you can take over.
Thank you. Now hopefully I can share right here. Did it swap?
Yep.
You see the right one? Okay. So like she said, I'm Heather Capella with the Department of Health and Human Services, and we are going to talk about transition from pediatric to adult healthcare. And I have to say, I'm a nurse, not a presenter, so you just got to bear with me. So first I'll talk about special health services. We are the program within the Title V Maternal and Child Health Block Grant that focuses on children with special health care needs. Every 5 years, we do a needs assessment to see what our priorities should be for the next 5 years. And we are just in, going to be starting year 5, and then also looking and evaluating what our priorities should be going forward. This is my 5th year with the state, so transition has always been something I have worked on since I started. And going forward, I believe transition will continue to be a priority for us. But there's also a lot of talk about medical home, which we've always tried to incorporate with transition, but there might be a little shift in the next 5 years, but more to come on that. So looking at some of our transition data and why this was chosen as a priority, with those children and youth with special health care needs, they undergo an extra stress and are more vulnerable. And so they need a little extra support. And so that's why we focus more on them. According to the National Survey of Children's Health in 2022, children in North Dakota that received the transition services was only at 21.9%. So we kind of have a long ways to go, I feel. And just comparing us to the national average, we're not bad in comparison. So I guess maybe we all need to do a little bit better with transition. But the dark blue bar is North Dakota, and then that lighter blue is nationwide. So like I said, transition from pediatric to adult healthcare is one of the priorities we're working on. And some of the current activities for our year 4 that we've been working on that we will finish up just in a couple months here is we provided transition toolkits. Last year, we sent the transition toolkits out to all pediatric providers in the state. This year, we sent out the toolkits to all the special education units. With me being the state school nurse consultant, I really try to get school nurses and the schools involved as much as possible with this priority, just because our kids do spend a lot of time at school. We tried to create a curriculum for schools to use, but part of the problem we've had with that is not every school has a school nurse, or they don't have someone who is able to present that for us. And so we have not made as much movement with that as we had hoped, but we're still kind of working on that. We did a transition webinar series with Got Transition that was presented a couple months ago. I also oversee some grantees for multidisciplinary clinics, and we have asked them to complete the transition readiness assessments with all of their adolescent patients that we see or that they see, and provide education. In the past, they were just kind of doing the assessment, but nothing went along with it. And so we asked them to review it with the patient and provide any education or feedback based on their answers. And then we provided some funding for Minot State to do this webinar series. So the goals of healthcare transition, we really want to improve the ability of youth and young adults with and without special healthcare needs to manage their own healthcare effectively and be able to use health services that are available to them. And then, of course, to help those clinics and other healthcare settings that see the adolescents to ensure that they are helping with that transition as well. So we really follow a lot of what Got Transition has. And at the bottom there, I do have the website, but they have the 6 core elements of healthcare transition that we like to follow. And those elements will help you define the basic components of a structured transition process, include customizable sample tools for each core element. They are tailored to the type of practice. Can't slow down, huh? Practice and facility. I think there's 3 different kind of packages that they, oh yeah, right there, 3 distinct packages. And we'll talk about the timeline. We really try to start having these discussions 12 to 14 years old, just to have them start thinking about it. And honestly, when it's brought up, parents haven't even really thought about it because we're so used to doing all of the appointments and answering for our child at their appointments when it comes to like health questions. And we really should be encouraging the youth to start speaking for themselves and learning their medications, their drug allergies, you know, if they had a problem, who they could call if they couldn't get a hold of mom and dad, that type of thing. So here's kind of a timeline we like to follow. We're going to go into the 6 core elements now. That first core element, policy and guide. They want you to develop a transition and care policy and guide with input from youth and parents and caregivers that describes the practices approach to transition. Want you to educate all staff about the practices approach to transition and distinct roles of the youth, the parents or caregiver, and the pediatric and adult healthcare team in the process. And then display transition and care policy guide somewhere accessible in your practice space. Discuss and share with youth and the parents or caregivers beginning at age 12 to 14 and regularly review as part of ongoing care. Second element, we want to establish how you plan to identify transition ages and then develop a process to track those that you discuss it with. If possible, incorporate into your EHR. Would love to see it incorporated into, I know a lot of clinics use the Bright Futures for their well child visits, and somehow incorporating transition into that and being able to record it within that would be awesome. Because a lot of times when we've talked with providers, they feel they're covering that in a well child visit, but if you talk to the parents and the adolescents, they totally missed it and did not realize that was something that was being discussed. Then at age 14, conduct regular transition readiness assessments with your patients, helping them identify areas to work on and provide education and resources on those areas of need. Next, they want you to develop and update your plan of care, including that readiness assessment findings, developing some goals and priorities with the youth, a medical summary and emergency care plan. Prepare youth and parent and caregivers for an adult approach to care, including legal changes in decision-making and privacy and consent, self-advocacy, and where to access the information. In your transfer package, you should include that final transition readiness assessment, plan of care with transition goals and prioritized actions, medical summary, and emergency care plan. Prepare a letter with the transfer package and send it to the adult clinician that you plan to transfer care to, and confirm with that adult clinician that they received the package and that they don't have any questions. They recommend that you reach out to the adolescent and family and see how that first visit went with their adult provider and ask for any feedback on the process and ways that maybe you can improve if needed. Wow, I really flew through that. So if you guys have any questions, I could even go back and we can go on to the website. Now I don't know if I'll be able to, if it'll share right. Is it sharing that you can see the website?
Yep.
Okay. So this is the 3 different, according to your practice, the 3 different ones that you can look at. I was kind of hoping it would take me right to. But the Got Transition website is kind of where we go for all our information when it comes to transition. It's most up to date and they're constantly working on it. So if you ever have any questions, right here, it'll cover everything about the 6 core elements with all your different resources you might want, how to implement it into your practice. There's the timeline that we went through. So yeah,
Heather, this is
anybody?
Krista.
Mhm.
One thing that I know is really cool on the Got Transition site is they provide billing codes for how to
Yes.
build into it, and I can share in the chat a link while she looks that up. Yeah, so it's pretty cool how much they offer on the site so that you can actually charge for integrating this into your practice.
I bet we can search it, find it faster. And 23. So your new ICD-10 codes. So in that webinar series that we had done with Got Transition, she talked about this. We're working on getting that webinar series posted onto our website. And I told Krista that I would once we have it posted, send it to her so she can share it out with all of you, because that was a really good series. I think you guys would really like to. And goes much more in depth than what I mean, I just briefly went over everything right now.
Yeah, this is great. Does anybody have any questions? Feel free to unmute or put them into the chat. If not, we'll go ahead and introduce our case presenter for today. Thank you so much, Heather. That was amazing. We'll make sure that we post some of those, or we'll post her slides up into iEcho. And after the case presentation, I can show you how to navigate in iEcho to find all of the additional resources that we've created and the slide decks in case you're not familiar on where to find them. So yeah, thank you, Heather. And we'll go
Thank
ahead
you.
and introduce Liberty Hicks and Emily Kirsch.
I will get the slideshow set up here. And then I will turn it over to you, Liberty.
Okay. There's some nervous energy. I'll admit that. Okay, so hello, my name is Liberty Hicks. I'm a research associate and self-advocate. I work for WIN, also known as Wyoming Institute for the Disability. Overall, I'm going to be talking about my healthcare transitioning and what was helpful, and mental health and overall wellness, and what was a helpful tool for myself. Next slide. So my healthcare transition was a bit interesting, mainly because there was a time where I didn't want to see the doctor for a couple of years. Luckily, I rarely get sick, so I'm okay. I saw a nurse practitioner until I was in my early 20s. I transitioned to see adult doctor this year, thanks to my mom. Things the doctor did that made me felt like I had a positive experience was that she had a casual conversation with me about my medical history. It felt like she was listening to me. There was no attitude that she thought she was better than me. She explained things in a way that didn't make me feel like she was talking down to me, and she didn't infantilize me, and she just treated me like any other patient who just needs some support. Next slide. Overall wellness is, for the past 5 years, I've seen a therapist. It's been a very positive experience for me. Love therapy. I think everyone should see a therapist at least once. We just clicked. It was nice. She actually helped me recognize that my creativity, my storytelling are all deeply connected to my mental health. She has helped me to recognize that my body language express a lot of my feelings. For example, when I curl up in a ball, I'm uncomfortable. I'm trying to hide away, trying to keep myself safe. When I'm sitting comfortably, I'm letting myself be vulnerable. I'm showing myself. I'm letting myself be seen. Next slide. These are called Liberty's Lessons. It's a bit tongue-in-cheek, I know. And it is treat patients the way the patient wants to be treated. So the golden rule does not apply in the medical world. Doctors should not dictate your life, but they should support your life. It's important for a patient to know that if it's just not working well with your current doctor, you can find a new doctor that works better for you. And plain language is always a safe bet because sometimes we're so used to using acronyms that we forget that not everyone does know. That's why I explained WIN's acronym. Next slide. Now we're getting to the meat of my PowerPoint, and that is the medical notebook. It is a binder that I have that this is a binder I can bring to my doctor appointments if needed. This is a very helpful tool for anyone, not just those who have disabilities. Everything's in one place. You don't have to remember everything about your medical history, especially since I don't have good memory skills. It encourages independence and more comfortability with your medical history. It's a very useful tool. So then you don't need to call your parents, guardian, or family members to know what you need to know. Next slide. It's simply a 3-ring binder with some dividers in it. Next slide. And mine personally have these 4 sections within it, and that is symptoms, context, whatever, phone calls, and appointments. Next slide. And here we have a handful of the symptoms. The pain chart is what they use in the hospital, in fact. 1 means no to very little pain. 10 is extreme pain. We have a medication time chart every 4 and every 8 hours because the math can be complicated. I do recommend try to keep it as a 0 o'clock or even something 30. That makes the math a little easier. And we have a usual illnesses chart: headaches, drink some water, take some ibuprofen, stomach aches, diarrhea, flu, cold, runny nose, and sneezing, all that, and medication, a cycle. Can't say the word for some reason. Next slide. And here's a bit more from that section. We have how to take care of a bad burn, keep calm, call 911, do not touch a burn, do not take clothes off the burn, do not put water on the burn, do not put cream on the burn. Next slide, please. And now we have the contact list. This is basically where you can get all your phone numbers all in one place. There's even a section for calling a hospital. if you need them, because sometimes you just need to talk to them, because if I remember correctly, that's where you get a lot of your surgeries from. And you can even add family members to this list. Next slide. And this is the phone chart, phone call section. Basically, it's just a script. So then you have something to say, because a lot of us gets phone anxiety, and sometimes we just forget what to say. So a nice little script for you to use. Next slide. And here is a medical history section. This is a bit different than my personal one, but always find one that works for you. It basically just has of like, oh, let's say your mother had cancer. You now know there's cancer on your mom's side. And in the medical world, it's referred as maternal, so mom's side, and paternal means dad's side. So make sure you keep in mind which sides it is, because with some medical stuff, it's more common on mom's side or dad's side or something like that. Next slide. And here is the appointment sheet. Basically, it's a good way for you to have things you want to be checked and you're afraid you won't remember. It's almost like having a grocery list in a way. Like, let's say you have a bump on you, you're going to have it on here saying bump doctor needs to look at. And you can go, oh yeah, I need you to check this bump I have. Next slide. And this is some stuff that I have thought up that might be useful for others. For example, testing results, seeing the eye doctor, the dentist, other specialties, and a section where doctors can communicate with one another. Next section. Here are our resources, which our lovely host shall give to you guys. And this is all the stuff we could find, because some of these are very old, so we couldn't find the original stuff. Next slide. And here are the two questions I have for you guys, and that is, what other tools have you used to support healthcare needs? What barriers have you experienced while helping your patient, yourself, or family members during a healthcare transition? And that's the end of my slides.
Thank you so much, Liberty. And these are really great questions. So please feel free to unmute or add into the chat. So have you guys used any of these tools that we've talked about today, or have there been any other resources that have helped you support people with disabilities and children with special healthcare needs with their healthcare needs? We'll give everybody a couple of moments to put their answers in the chat. And thank you so much, Liberty. That was a really great presentation.
I use Etsy a lot to get different like templates and information together. So a good friend of mine is 28 and she's already had one back surgery. She's having two more, but now she's a mom of a toddler. And she'll be out, as you can imagine, after two major back surgeries for a few months. So I created what I call a digital care binder, basically with all the tools that were just presented. So that way, like in my mind, it'll be a central point on their fridge, like family emergency contact sheet, the local providers, when to follow up, because some of that stuff is really, like, even if you know it and it's really easy, like allergies or date of birth or address, when you're overwhelmed, you forget about it. And so I'm like, whoever is coming into her home, right, to take care of her, or for her husband who will have a lot more on his plate, it's just like a central place for reminders. So I literally spent hours finding templates for just like this yesterday.
And you said you found all of those on Etsy?
Yes, on Etsy.
Was it just like a digital
Too.
download?
Yep, they were almost all digital downloads. So there's ones like a medical health planner. There's some, so I basically did like symptom tracker. I did emergency contact list. I did, right, like here's a severity and symptom tracker. Some have family emergency binder kits. I can find a few links and put them in the chat. And most of them are just digital downloads. And then you could print them. They're like $1, $2, something. You can print them and then fill them in, or you can, if you're crafty enough, you can edit it online and then just have a digital copy too that way.
Yeah, that's great. That's a lot like what Liberty has with her binder, but yeah, just in a different form and easy to see.
I wonder if Tammy, the one who gave me the idea of it, was inspired by that, because I don't know where she got the idea of that. I wonder if she just got inspired by those. Tammy Allmutler, by the way, who was in charge of Transition Academy.
And we
Krista,
do-
I have a question or a thought. Liberty, this was amazing. Great job. I honestly think that this would be so beneficial for like really any child who's transitioning to adulthood and adult care, but also I loved how I think there were a few of my favorite things, like the scripts, because you're right, there's so much anxiety about talking on the phone, figuring out exactly what to say, what you need to say, how to make an appointment, especially with the digital world that we're already in. So that I loved that, but also as I'm a stepmom to a kiddo with a neurodevelopmental disability, and I think this is going to be really helpful to just as like even a guide to kind of start talking to him. He's in middle school, just about the things that he needs to learn about himself. That maybe me as a parent have taken advantage of that he may not be remembering or even know what to ask. And so, that's how I'm planning to utilize this. Thanks, thanks, Emily and Liberty.
Yeah, thank you for weighing in, Ty. And we did have a comment earlier, if they have a provider, maybe have the provider talk to the doctor and let them know what they are seeing that they may need help with. So just a clarifying question, are you talking like if they have like a specialty provider or like a mental health provider? If you could clarify that, that would be awesome. And I'm seeing a lot of resources being posted into the chat, so thank you for sharing those, and please feel free to check those out. I love Etsy and how you're able to just oh, okay, perfect. I love how Etsy you're able to do a digital download. I usually will send it to Office Max and get it printed on like a little bit like cardstock, and it's yeah, super cheap and usually pretty to look at. I'm very into graphic design, so I get a little snooty if you hand me something in Comic Sans. So
I pay a little more attention when it has pretty colors and different fonts, and I can't do
yeah.
that.
Okay, and thank you. So they clarified if the person works with a developmental disability provider, communicating back and forth with the doctors. I know the agency that I used to work for had a really good comprehensive system where they used the doctor notes almost exactly like what Liberty had showed from her binder that said the symptoms, the reason for the visit, and then it had like a empty spot for notes from the doctor so that they could communicate back and forth. I guess I used to assume that that was just common practice, but then I've heard from some other different developmental disability providers that they don't have those same systems. So if you are working in that space, you know, maybe take a look at that and making sure that things aren't getting lost in translation with the people that you're working with.
Yeah, I don't know if that's, I didn't know if it's common for doctors to communicate with one another or not. Mainly because I am luckily not very medically ill. I'm just developably, okay. But I have heard it's very common for doctors to not communicate with one another. That, and also I'm pretty sure it's just a tornado of confusion, especially with medications that can sound very similar, like in my mind, it just makes sense to have a section where doctors can talk to one another because they can understand one another easily. That not so. It's putting less pressure on parents because let's be honest, this could be a useful tool even long before your kiddo has transitioned to adulthood. You can use it even now when they're little because at least everything's in one spot. That's the main idea, is everything's one spot. It's not sticking over here, sticking over there, whiteboard over here. It's on all one place, and you don't have to worry about technology not working too, which is nice.
So I'm an LCSW now, licensed clinical social worker. But before I was a foster care worker in South Carolina. And so kids in foster care typically have a lot of higher needs, right? Disabilities, whether it's physical, mental, a lot of various medical needs. And so they all got healthcare passports. So anytime they moved from home to home, the case manager's role was to make sure that the foster parent was updating the passport, and it looks just like Liberty's binder, right? Maybe a bit more like state formish, but it was literally a binder, or some people just had folders, and the case manager kept a copy, but so did the foster parents. And so then you get a new kid in your home and you're just like, here it is, especially for the medically fragile infants where stuff happens so quickly, and you don't always know. We had one foster parent in particular who only took medically fragile infants. So one baby had chicken baby syndrome, so bilateral subdermal hematobos, bleeding on both sides under the brain, and came from a Spanish-speaking family. And so that was a really helpful one because it was like, as you can imagine, all the bajillion providers plus translators. And so it was really cool to be able to see, like, when, sometimes even the basic things of like, when was their last dentist appointment? When was their last physical? But of course, for the more complex, like when were surgeries and when were follow-ups? So that was probably like 6 or 8 years ago, but it was, the state of South Carolina was really pushing they were called healthcare passports, I think is what they were called, to be in with every foster child and to move into every home. And I had one that did amazing at keeping a physical binder that she kept 3 copies of it, essentially. Like when she left the visit, she'd be like, all right, I want, whatever the form is, give me 3 of them, one for herself, one that she gave to the case manager, and then one that she gave to the biological parent.
Yeah, that's great. Especially keeping track of like all of the different appointments that, like, when was the last visit, because that's something that can easily get lost in translation if you're moving and you have big things going on in your life. And especially over like cross-cultural like providers and stuff. So thank you for sharing that. I know in North Dakota we have the ND HIN during our health equities or our medical home series that we did in 2022. There was a presentation on that. Heather, do you know any more? Can you explain what the ND HIN is?
So it's a kind of like electronic health record statewide. The hiccup that we're seeing with that is not all facilities are utilizing it. So not all a child's information may be in there to be viewed.
Is that something patients could advocate for?
Yeah, and we even have some providers that we work with that are trying to get their facility to jump on board with us as well. Sometimes we hit roadblocks. So it has been hard because I do a lot of care coordination. Like any child born with a critical congenital heart disease, that's a mandated reportable condition, and those reports come to me. And I reach out to the family to make sure that all of their needs are being met and how can we help this family. And I'll try and go into the HIN to get any records that may have been in there. And there are several facilities in the state that don't utilize it. So a lot of times I'm relying on the parents to give me the information as to when was the first surgery, what's coming up, kind of thing. So it would be really nice if we could get more people using it, more facilities using it.
On the provider side, and even on sometimes the parent side, you can look in for insurance. So I have Blue Cross Blue Shield, right? Or Sanford is an easier one. You can go online and look or call and see, like, hey, when was the last well child check? When was the last routine, blah, 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 whatever? When was the last I don't know, my kid just got his tonsils out. When did that happen? Because, right, some procedures insurance will only pay for, once a year or once every 6 months. And it doesn't matter who the provider is, right? If it's in like different systems, insurance knows when they paid for it. And so it's an easy way to look at their EOB or explanation of benefits to say like, oh, yes, this child already had it, or this child's due or overdue, or right, like something simple like the dentist cleaning is like, well, it's every 6 months, not 5 months and 30 days. Don't schedule it for them. You have to schedule it for 6 months and 1 day out. So that sometimes is not really more like comprehensive, but it's a lot of times people's health insurance doesn't change that often. And so you can always call the insurance company and ask for like an annual statement or an explanation of benefits to see what procedures you have had.
Yeah, that's good to know. That's really great advice. I wrote that down and I'm going to include that in our additional resources. Heather, there was a question for you in the chat. What conditions are reportable in your state or in North Dakota?
There's quite a few. I would have to go onto the website, but just for what I follow, it's the CCHD or the critical congenital heart disease.
Are those the conditions that are screened for during like the newborn screening process?
Yep. So at birth, when the child, they do that pulse oximetry after birth. If they don't pass that, then they'll probably look at doing like an echo, and then that heart condition is maybe diagnosed. A lot of times these conditions are diagnosed prenatally, and so that's not done at birth because they're probably end up delivering in Minnesota because of the heart condition.
Thanks, Heather. That question was from me. This is Ty. So I'm really curious about this, and I actually have no idea about Wyoming, but isn't it even if they deliver in another state, if you have that requirement in your state, that facility would still need to report, or is it getting missed typically?
So what we've started, those kids were falling through the cracks because they weren't being reported. So the first time that baby will see the pediatric cardiologist in North Dakota, they report it to us. So a lot of times I don't connect with these families until they're a few months old because they've been in Minnesota to deliver and are there after their repair, their surgery. Sometimes, I mean, we just had one kiddo that just came home for the first time. He's 15 months old. That's how long he ended up being in the hospital in Minnesota, in Minneapolis. So
I have a lot of different state experience because I'm a military spouse. I am licensed in North Dakota, but I now live in Tennessee. When I was in grad school in South Carolina, we always had border state agreements. So like right, South Carolina, North Carolina, right next to each other. So any of those counties that are kind of along that line, right, like Fargo, Moorhead, whatever, whatever's along the state line, then a lot of times those counties specifically would start to have agreements with each other. Especially whenever we worked when I worked in child welfare, it'd be like, hey, we know mom is pregnant, we know mom is using. And so typically they would flee the state and go to a different state. And so we could also call other hospitals to try to get connected to services before baby was born, right? Like if you know that in utero, some of those experiences are going to be happening. So it's commonly referred to as like a border state agreement, or this is a foster care and then probation language is ICPC, an interstate compact, typically for the placement of children, but it could also be an interstate compact for the medical care pieces too. I don't know if North Dakota or Wyoming has any of those languages or practices.
I know because we are a border state, kiddos that are maybe born Grand Forks, Fargo, but live in Minnesota, we don't follow up with them, but we will reach out to whatever county or program that is closest to them just to make sure that they get the services that they should. But I don't actually reach out to those families. But with Minneapolis being 7 hours from me, those social workers at that hospital are pretty familiar with our program, and they will reach out to try and help when they're transitioning that baby home maybe, but yeah, it's the first visit with the pediatric cardiologist that's actually reported to the state.
And then I'm assuming it's for follow-up purposes to just assess development or developmental delays.
I will do a referral for like early intervention or right track. I will do a referral for Family Voices of North Dakota. Within our special health services, we have a financial program. So I kind of ask about insurance and if they have insurance, is it meeting their needs? You know, how is transportation, you know, with being such a rural state in Wyoming as well, you know, your specialty providers are in one spot of the state and you've got people traveling 4 hours. So is that going to be an issue for you to get to these appointments and see how we can help there kind of thing? Basically cover it all and try to get them so that they can get the best care possible so that kiddo has the best outcome.
It's great to know how much of this is going on behind the scenes. I mean, I have never experienced that of having to be referred. I mean, I've been referred to special education services through my son's pediatrician back when we had a special, like its own special unit. But yeah, it's exciting to hear that there's these programs going on in the background that for nobody who's dealt with them before.
Mm-hmm.
I want to say thank you for all the resources, Liberty, great presentation, and Jennifer for sharing all the resources, and Heather, all the background info on North Dakota. I was just wondering, Heather, I was curious about your curriculum with school nurses. Like what kind of things, what kind of conversations are happening in that curriculum with the students kind of in the school setting? Is it something similar, like they're helping support some of the conversations like Liberty brought up with the binder and taking independence with that? Yeah, just curious on that curriculum a little bit more.
Not a whole lot happening with it right now. It's just something that I put a PowerPoint together to this point, but we did have a contract last year with Family Voices of North Dakota, and they created a curriculum that they present and have been reaching out to schools and trying to do it in schools. And they cover a whole range of things from, I think, the brochure here. They'll talk about guardianship, they'll talk about the notebook. So they'll define transition, they'll talk about that readiness assessment, the timeline, SSI, SSDI, budgeting, medical insurance. And then they also will cover like IEPs and 504s and trying to incorporate transition topics into those as well to help the kids. Guardianship, and then they also talk about able accounts. So Family Voices is kind of taken over reaching out to the schools to get out there and present the curriculum. I haven't had an update lately since we no longer have that contract with them, so I'm not sure where they're at with that anymore, but it is available.
And Donine Feist, she usually is on these calls. I think she had another commitment today, but if anybody's ever wanting to get in touch with her, I'd be more than happy to do a warm handoff or introduce you guys via email. But I just put in the chat a link to their website with some resources for transition, and it includes some of the links that Heather had just mentioned.
And when they go and do the presentations, it's with the youth and parents. It's not like in a classroom just with the students. I really would like to see transition curriculum like in a health class or a gym teacher providing it, or, you know, if the school nurse, because I know they do presentations where they go into the classrooms, if it was something that they could do, yeah, just somehow get it incorporated since I wanted to get it into the schools since that's where our kids spend so much time. I thought that was the best avenue to go, but it's just been really hard because, yeah, staff is overwhelmed and sometimes they're short-staffed, and so it doesn't always, I haven't had very good luck with it yet. but we're not giving up.
Do most schools in North Dakota have school social workers or like assigned by region or anything like that that could help to facilitate the information, especially if it's like, right, I don't need to have a medical degree to gather the information necessarily or to connect those resources. I just don't know how common school social workers are.
I think most have them.
Okay.
And that's why a part of why too, I sent it out to all the special education units, because I knew every school had one of those at least,
Yeah.
where they don't all have a nurse. So yeah.
Thinking back to your presentation, though, it was interesting how many kiddos without any special healthcare needs or disabilities receive transition services. Like this seems like it's a gap for just that whole age population.
Yeah, I think oftentimes when the kids turn 18 and they maybe leave for college and they go to that first appointment and they don't know anything because mom has always been there. Most pediatricians, I worked in a pediatric office for 8 years, and most of those pediatricians were pretty good at making sure that the child answered, and would even sometimes cut the parent off and be like, nope, I need your child. They need to learn, to be able to speak up on their behalf, but not all do that. And I've started making my daughters, they're almost 17, go to appointments on their own so they can't rely on me. And I have a good relationship with the providers, so I know they'll reach out, if they truly needed something. But my girls are like, can't you come? And I'm like, nope, you've got this. Mom won't always be there. So, yeah.
Well, I greatly appreciate this conversation. I think that there's some amazing resources shared in the chat, and thank you guys all so much for weighing in. Do we have any final questions? Jody did just post the post-test and evaluation form into the chat. So if you were looking for CMEs or contact hours, please fill that out. Also, please just fill it out so that we can see how we did with this session. So we really, really thank you guys for attending and hope that you guys all got something out of that or out of this series. We do have another echo coming up, the direct care resilience. This series is focused on supporting the mental health care needs of the direct support professionals that work with people with disabilities in like disability provider settings, also in like nursing home settings. It is mental health best practices. So we kind of focus in 3 different areas on this series. We have how to support mental health at like an organizational culture level. So how do you incorporate, like how do you support the mental health of your staff and set that precedent that, that this matters at the organizational cultural level. We also have some sessions that are around supervisor training. So how do we recognize when our staff are starting to feel burnt out, and how do we intervene with that? And then we also have some sessions that are simply just how to do self-care and take care of your mental health. So we don't have an exact date of when that's going to launch, but we do know it's going to be later in May. So if you guys are curious or interested, I can definitely keep you informed when we get that series launched, and we will be offering social work contact hours for that series as well. So once again, thank you guys so much, and we hope you have a great rest of your week and month and year, I guess. And thank you, Heather, Emily, and Liberty so much for presenting today.
Thank you.
I guess I could have posted a link to